In 2000, July of 2000, I was diagnosed with squamous cell carcinoma of the lateral border of the tongue. Basically, I'd had a fractured tooth, and it had rubbed a little bit of a raw spot in the side of my tongue. And when that was fixed and a crown was placed and everything was healthy again, the sore didn't go away. And giving it reasonable time to heal, it still had kept on going. So I had it checked and realized that things were not going through a normal healing phase, that it was that there was something wrong. So once that had been determined, the next day I went to an oral surgeon and had him evaluate it, and he decided that yes, I was right, there was something that was amiss in the healing process. And he took a biopsy of the side of the tongue where that original sore had been, and sent it off to a lab. And I went off on vacation, and with a couple of stitches in the side of my mouth, which is a great way to start a vacation. I came back and had a phone call from the oral surgeon. He said, yes, it was oral cancer, which shocked me because I don't drink, I don't smoke, no human papillomavirus, no HPV, which are among the more common causes of oral cancer. So I'm a very low risk individual. So it did come as a shock at the time that I was indeed facing cancer. Within 2 weeks, I was into the OR and having it addressed. They did surgery, took about that much, about the tip of my thumb portion of the side of the tongue away, and closed it all up, and I healed very well. The most challenging aspect at that point was talking, because I had a piece of the tongue missing. And so I went in for some therapy and was able to come out of that very quickly, and things worked out well, and I was very happy with my life. I was checked every 3 months just to make sure that everything was fine. And things rolled along rather nicely until 3 years later. In 2003, the cancer came back. It was stage 0, which involved something we call leukoplakia, white spot. And since it was a superficial lesion, it is actually something that you can visually see that there were changes going on. Had it checked, it was stage 0 cancer in situ is the phrase that's used. Which again surprised, because we thought we had it all under control. They went in with a laser and basically ablated, just burned away that section of the tissue, and I was fine thereafter until it came back again. And by the 5th time it had come back, it was no longer 3 years in coming back, it was 3 months. So at one checkup I had it addressed, the following checkup 3 months later, it was back again. At that point, we realized that we needed a different approach. And we were now 6 years into the process, so 2006. At that point, I had a separate surgery done, which took a split thickness skin graft from my hip and put that dermis tissue into the mouth over the original site. And that actually changed things completely, and I've been cancer-free for the last 14 years. It was a traumatic period. I'm happy to have it behind me. And it opened my eyes to the impact of oral cancer on people's lives. I check everyone who comes through my office over the age of 18 for oral cancer, very thoroughly. And I feel that was and is the silver lining to my experiences over that 6-year period. I still don't take it for granted, but I appreciate life for all it's worth.